carpal bones are a group of 8 small, irregularly shaped bones located in the wrist. They form the connection between the forearm and the hand and are crucial for wrist motion and stability. Now, these bones are organized into 2 rows, which are the distal and the proximal. On the proximal row, which is the one closer to the forearm, we have from lateral to medial the scaphoid, the lunate, the tranquitrum, and the pisiform. Now, the scaphoid is a boat-shaped bone, and they are most commonly fractured in wrist injuries. Number 2, the lunate. The lunate is a crescent-shaped bone involved in wrist flexion and extension. Number 3 is the tranquitrum. It is a pyramid-shaped bone located posterior to the pisiform. Number 4, the pisiform. The pisiform is a pear-shaped sesamoid bone embedded in the tendon of the flexor carpi or nares. Now over to the distal row, which is the one closer to the hand. From lateral to medial, we have trapezium, trapezoid, capitate, and hermit. Now, the trapezium supports the thumb and it forms the carpometacarpal joint, which is the CMC joint. And then the trapezoid is the smallest of the distal row bones. It articulates with the second metacarpal. And then the third one in the distal row is the capitate. The capitate is the largest carpal bone. Now you have to try remembering this because it might come out in your exams. The capitate is the largest carpal bones, and it is central in the distal row. It plays a key role in stabilizing the wrist joint. And then the fourth one in the distal row of the carpal bones is the hermit. The hermit is recognized by its hook-like projection that provides attachments for ligaments. So here are key features about the carpal bones you have to remember. Number 1 is the articulation. The proximal rows articulate with the ulna and radius to form the wrist joint. And then the distal row articulates with the metacarpals to form the carpometacarpal joints. Now, the functions of the carpal bones. Number 1, they provide stability and mobility for the wrist. And 2, they facilitate movements such as flexion, extension, abduction, and adduction. Now, the clinical relevance of the carpal bones. Number 1 is the scaphoid fracture. If you remember, we talked about how the scaphoid is prone to fracture when there is any accident to the wrist. Now, the scaphoid fracture is actually common. When you fall with an outstretched arm, you are most likely to have a scaphoid fracture. And again, is the carpal tunnel syndrome. Now, there is this median nerve that passes through the carpal tunnel. When it is compressed, when it is compressed, the patient will have this carpal tunnel syndrome. Finally, let's learn the mnemonic to remembering carpal bones. The one I usually use from the lateral to medial is quite simple and interesting. And it goes like this. Some lovers try positions that they can handle. Or you can go, some lovers try positions that they can't handle. Whichever one you remember, the difference is just can and can't. So for some represents the scaphoid, lovers represent the lunates, tri represents triquetrum, and then pisiform positions. Then for the distal row, we have that they can't handle. So for that we have trapezium, for there we have trapezoid, for can't we have capitate, and then for handle it is hermit. So the carpal bones plays an integral role in the hand and the wrist functionality, as we talked about the motion and how it creates stability and mobility for the wrist joint. And understanding this anatomy is essential especially for those studying radiography, because you are going to be asked to do probably wrist joint x-ray or scaphoid x-ray